Dianabol, the breakfast of champions, as it's known, because it was. This video will be about Dianabol, Methandrostenolone. I have to present this because as the anabolic doc, I have to now go back to the history of where anabolic, androgenic steroids originated. These are the agents that have led us to today. And in this presentation, I will discuss the incredible history of the first oral anabolic steroid known to man, Dianabol. I will go into the scientific and the pharmacology, the background. I will go into the side effects. And then, most importantly, I want it to be known the deadly side effects of this, the sexual side effects, the cardiovascular side effects, and the interesting, most deadly side effects leading to liver disease. And this does usher in the concern of the oral agent and people, men using this over decades, worried about using oral agents because they saw this drug and the side effects known to physicians, because back in the 60s and 70s when it was widely used for medical people. And we'll talk about that. And the irony today is that this drug by newbies and new people, including women, will use this drug all over the world. This is not just in America. Matter of fact, less in America. It happens, this phenomenon happens more outside America. And I want you to read and to watch this video and read my data to be warned. There's a paradoxic illness where people will use this oral agent thinking that it's less toxic than injections. They don't want injections. People are terrified of injections. So they think this is going to be safer. And no steroid is safe, but this can be severely toxic. And we're going to discuss that today. But with no further ado, we go into the history. This chemistry, this compound, Dianabol, was first conceived in 1955. And then we have to go into bringing in someone very important for this drug, a doctor named Dr. John Ziegler, a team physician for the U.S. Olympic weightlifting team. At that time, he apparently, the 1956 World Games, he saw the Russians suffering androgenic side effects of this drug, where they had to be catheterized through their penis because they couldn't pee. And Dr. Ziegler noted that. And then he, at that time, and Ciba pharmacies went to the drawing board and perfected this medicine to bring to market for an anabolic steroid that had more anabolic versus less androgenic properties. That's why it came on, because he saw the Russians suffering with what was thought to be androgenic issues and the closure and blocking of the prostate and the need for catheterization. Now, the history is true that this is in history. This is known that Dr. Ziegler made these statements. I wonder the validity of what he saw or what was really happening, because we know that men then were using testosterone injections. And those had to be short-acting suspension, testosterone suspension. And we know that young men, those were young men, those were not older men or middle-aged men, those were young athletes. We know today that men do not suffer when they're very young with blocked and shut down prostates and lower urinary tract symptoms. Very rare. I'm the anabolic doc. I can note this. So I wonder what he saw. But indeed, this was the history. So let's continue. And then later, in 1958, with the help of Dr. Ziegler, Ciba Pharmacies brought to market Dianabol. Now, as the history goes into the 1960s and through the 60s, after about 10 years of this being on the market and being abused and used by athletes, Dr. Ziegler condemned the use, and he was out of it. This drug was on the market in America for medical use. Interesting, for aplastic anemia, So when someone's catabolic and sick and they're anemic, they've realized that these drugs, anabolic steroids, can build up red blood cells. And we know that we can have issues with that today. So that's why it was used medically back in that time. It's incredible. Also for post-menopausal women for osteoporosis, not to mention other catabolic issues. So the FDA pressured and put pressure on CIBA pharmacies to come out with a list of offerings and medical utilities that were reasonable, because they were starting to worry about this drug, and they came up with those real medical indications. Now, all the way through the 70s, still used, and in 1983, it was finally removed from the market in America. And of course, in Europe and outside America, there was generic production of this, even up and through today. And now today, it's basically completely an illicit drug that's manufactured as Methandrostenolone, which is the common name. Now let's go into the scientific pharmacologic background. This is a derivative of testosterone. It's an oral derivative. That's why it started from back in those early days when they had testosterone and they started to tweak that testosterone molecule. What do? It's that classic 17-alpha alkylation of the 17th position carbon. They put a methyl group there, 17-alpha alkylation. They also did something else. Remember, Dr. Ziegler thought this was too androgenic, so he wanted to reduce the androgenicity. How do they do that? They put a double bond between carbon 1 and 2, and that reduces this affinity for the androgen receptor, at least for the side effects, they thought. That's controversial too today. Absolutely, those two changes chemically produce, those two slight changes produce Dianabol from testosterone, an oral agent. And now subsequently from that time on, we have many oral agents. And now we lead into the side effects. The first one is it undergoes aromatization. This is a highly aromatizable anabolic oral steroid. And with that, what do? We see classic side effects with water retention, gynecomastia, and that bloated, big, puffy look. You can gain tons of weight on a 6 or 8 week cycle of this drug with a moderate dose or heavy dose. Men have gained 40 pounds. If there is a lot of water, there's muscle too, and they get strong. This is a classic bulking drug. Interestingly, during the use of this drug, you see a lot of men use, which could lead to the toxicity of this drug, the anti-estrogens, aromatase inhibitors, selective estrogen receptor modulators, namely tamoxifen. And interestingly enough, another incredible historic piece is the use of proviron, which is a weak anabolic androgenic steroid that is used with this for its anti-estrogenic side effects, but it also is anabolic. I found that to be classic, as the old classic steroid users have come to me from the 1970s. I take care of some of these men. It's been incredible. They used Dianabol and everyone used proviron with it, not to mention a mix of other drugs. Now, interestingly enough, why it's also estrogenic is because this medicine doesn't only just convert and through aromatization, it has a very biologically active compound called the 17-alpha methyl estradiol, and that itself is more potent than estradiol itself. So there you have it, kind of a two-hit scenario on the estrogenic side effects. Next, androgenic side effects. Now, this was produced to be less androgenic, yet it does have those properties. It still will convert to DHT. It will still hit the androgen receptor in the central nervous system, not to mention throughout the body, although it does have a lower affinity. And it's interesting that this drug can be blocked slightly by the use of finasteride and dutasteride. Those are DHT blockers, but you just don't see that used too often, in my opinion. The next piece that has to be discussed regarding the side effects and these androgenic side effects will be the sexual side effects. This medicine absolutely will affect the hypothalamus pituitary testicular axis and cause various degrees of anabolic steroid-induced hypogonadism. Now, is it known that it mediates through the androgenic or the estrogenic side effect? Remember, it's highly estrogenic steroid. And does it block, in effect, that feedback loop up in the hypothalamus, disabling the gonadotropin-releasing hormones that feed and direct into the pituitary? We don't know. But in the end, we know that there are sexual side effects. And this is historically, in my opinion, where PCT really came into use. Probably back into the late 90s, mid 90s, late 90s, and up until today, because of these drugs. Not to mention this drug itself. As we talked about the estrogenic effects and using the classic drugs that we see known to be used in PCT cycles, aromatase inhibitors, tamoxifen, not to mention human chorionic gonadotropin. The next devastating side effects now, cardiovascular side effects. It's an oral anabolic steroid, androgenic steroid. It affects lipids. Everyone knows that. It will tank the HDL and it can increase the LDL. Now, for men and women, not to mention, that have this as a family history or they have their own particular history, this could be devastating, certainly over long term. Now, the interesting effect that I, as the anabolic doc, who I enjoy to protect heart disease from people, I will elaborate on what I see. So, the endothelial destruction of the inner wrapping of your artery is your lifeline. It leads to coronary artery disease, not to mention it's implicated in left ventricular hypertrophy and lowering ejection fractions that cause heart failure or early heart failure. So how does it work? Well, you would take the steroid, you build a lot of water up because of the estrogenic side effects, not to mention just the shifting of the water from this drug itself, mainly estrogenic side effects. You develop water and puffiness. That leads to hypertension. That hypertension can destroy the inner wrapping of the endothelial tissue, not to mention lead to sustained hypertension and left ventricular hypertrophy. This is a classic dangerous drug for that. And that's why people hopefully do not use this drug for long. Hopefully they don't. Hopefully they don't use this drug at all, of course. But if you use it long term, it can be devastating. Now, there's no data for the co-administration of fish oil. I'm not going to discuss these details and put down anyone that recommends it, but there's no data on co-administration of fish oil for protection of cardiovascular disease without steroids. It certainly is not going to work with this. So don't think you're going to use a steroid and take a bunch of fish oil and you're going to be protected. It doesn't work that way. And please, don't ever use co-administered statin drugs. I enjoy to use statin drugs on my patients free of oral steroids because this is going to lead to severe problems, mainly with the liver. And this brings us to the incredible, most devastating historic side effect of this drug is the hepatotoxicity, the liver disease. So this is because of, this is a alkylation of the 17th carbon. This is a drug that will repeatedly, at least for 5 hours or so, go through the body over and over, minimizing the first pass effect and going through the liver. The liver is taking this and processing this. Now, as the liver is processing this medicine, not to mention any oral anabolic steroid, it's going to cause a degree of injury to the liver, from minimal reversible injury to devastating irreversible injury to the liver. Let's talk about that. The first piece is transient elevation of liver enzymes, hepatic transaminases they're called, and that's ALT and AST. And everyone knows this and they have to watch for that. But when you're on these drugs, not to mention almost any oral anabolic steroid, you're going to see an elevation. The good news is when you stop the drug, they come back down to normal. And the liver is protected. The liver is very strong, but you don't want to push it, obviously. Number 2, this is where it gets tricky. You have acute to chronic cholestatic syndrome. That is where you start to damage and you start to affect the liver's processing ability to move bile through it. And bile will build up, and there's inflammatory damage. This is now the long-acting effects now of being on these drugs too long, these oral anabolic steroids. Now, what happens? There are genetic defects people will be susceptible to with iron overload, with hemochromatosis, hereditary hemochromatosis. If you have that, this will be much worse for you. If you have any type of cholestasis, if you have any kind of gallbladder issue, this could be worse than you. It can even worsen that. If you have hepatitis C, I've seen all these things. These are why these men, you line the moons up. They have hep C because they did drugs, or they have hepatitis B because other parts of the world it was delivered vertically through the mother and they have it, and then they use oral steroids. The moons line up. It's incredible what I see. So if you have any of these conditions, you can lead yourself into liver injury through what's called this acute or chronic cholestatic, which is slowing down of the processing of bile. Next piece is now it's getting worse as we're going on. Obviously, this is when the drug is used more for months and months and months, even years. We used this drug as doctors back in the 60s and 70s for medical disease, on women too. That's where we learned this from. It's amazing that most people, men in the United States, know not to use these drugs too long. 6 weeks, 8 weeks, come off, be very careful. It's amazing, apart from America, and I want this to be heard in the world, because they're scared of needles, they use this more, and I give that caveat. So this next piece is chronic vascular injury, and there's a condition that I've seen, very rare though, pileosis hepatis. Basically, this is damage inside the liver, and you're getting blood-filled cysts, and they could lead to right upper quadrant pain, hyperbilirubinemia, where the person's jaundice, and nausea, vomiting, and even there's been rare cases where they actually start bleeding and they're anemic and they're going to collapse, vascular collapse. Now, the last piece, the rarest and most rare piece that I've seen, is the development of hepatic adenomas. Now, those are going to be real, those are solid filled adenomas, tumors that are either tumors and they're mass occupying and they have to be removed, or they convert to the old classic and dangerous hepatoma, which is a real malignant cancer of the liver that we see with cirrhosis, for an example. Again, this is all very rare, but I've seen it. So with this said, I want people to be very careful and to understand what they're getting into with any steroid, especially this steroid. This is no joke. It does work, but there's no free lunch. And with that, you're going to want to see a doctor. That's why I'm here. I want people to come see me, do consultations. I want people to have blood work done. It's interesting that the blood work doesn't always tell the tale. Do you realize in this last part of this liver injury, the transaminases are normal, but the bilirubin levels will not be normal. And we as physicians have to make a decision. Do you have other medical issues? Do you have a condition called Gilbray's? Men that are under my care know that I teach them this. How do I differentiate Gilbray's, which is a normal variant of elevated transaminases in face of no other diseases of the liver? And we have to be very careful, because could you have one of these issues going on and building up because you have some other issues of your liver or GI tract? This is very complicated medicine. I am so humble as I've been doing this, only this, as an expert medical physician for well over 10 years now, full time. And every day I make decisions and I have to be humble. And sometimes you have to say, I don't know, but I'd like to help you and coordinate care with you. And that's how I work. And on that, I close this presentation of Dianabol, the true breakfast of champions. Please be careful, and I really hope this helps people. Thank you so much. Dr. Thomas O'Connor here. I'm glad you made it to the end of the video. If you liked it, hit the like button and please subscribe to our channel.
And I look forward to bringing you more cool and interesting videos just like this in the future. Stay strong and healthy.